Thank you for the opportunity to explain to you, and in response to the 3 questions that I need to answer. I think that they are answered during the presentation that I'm going to be giving, and if not, then please remind me, but I have addressed them, I believe, in the talk that I'm going to be giving now. Let me just say that we are talking about an outline of a review that is taking place of the National Drug Master Plan. And I want to just emphasize right at the very beginning that this is a draft 0 that we are working with at the moment, and that there are plenty more consultations that are still going to be taking place. There is plenty more that needs to be revised in terms of the first draft that we are talking about now, and that there will be, at the end of the day, more consultation taking place. So what I'm showing you is certainly not anything like what the final document will possibly look like, and that there is still plenty of opportunity for inputs to be given as well. So we're looking at, and by way of introduction, I will show you the roadmap that we've used in the review of the National Drug Master Plan, how we have used the 3-dimensional model in terms of addressing the problems that we've identified for ourselves, and also giving you an integrated and balanced approach that we are looking to now include in the new Drug Master Plan. The process and the progress to date has been the substance use reviews, which are taking place in terms of what is happening internationally, what are the best practices that we can learn from and adopt and use as a strategy for South Africa as well, recognizing that what we sit with in South Africa is different to other parts of the world. And whatever policy we are using will have to be adapted to our environment in order to suit our needs here in South Africa. We've used a PESTEL business plan to help guide us in terms of the necessary changes, and I'll give you more detail about that as well. And then just looking at the way forward and the way that we're going to be advancing the whole process. So the National Drug Master Plan is the blueprint that we use for the entire country, and then gets used to then inform the provinces, and eventually right down to the local drug action committees where the need is and where the actual work is taking place. But we need to understand, and that's the answer to the one question, is who are we responsible to? We are a statutory body mandated by the Prevention of and the Treatment for Substance Abuse Act, and that is what we have to take as our guiding principle in terms of what we are doing and what we are allowed to do. It does not necessarily make it that we are always comfortable with what we have to do, but we certainly have to work within that framework and give as much guidance as we can to Parliament and to the policymakers. We sit as representatives of government. We sit as representatives of the communities that we come from. Some of us are there in the academic field. And at the end of the day, we are working with 17 government departments as well as 3 entities from government, which makes it sometimes very, very difficult to influence the outcome at the end of the day, because each of those government departments have their mandate that they have to use and that they have to work within as well. So the fact that we are sitting there with government departments and then trying to influence government in some way restricts us in terms of what we are trying to do. The only way that we are going to be successful and more meaningful in terms of what we need is to become as an independent entity on our own. And this is one of the moves that we are working on very, very strongly in terms of trying to influence the department and government to allow us to be an independent entity, which will give us the ability then to be able to formulate policies and advise independently, rather than working within a department and then still being sanctioned by the department in terms of what they will be comfortable with and what they are not comfortable with. So please accept that one of the big problems that we are facing at the moment is the fact that we are still sitting inside a department, and we are working very, very hard to try and move outside, put us in the presidency, put us in the deputy presidency, but remove us from a department where we are answerable to a minister, a deputy minister, as well as all of the other line function people, and that can sometimes be very, very difficult to work with. However, the guarantee is that we are working very hard in trying to correct that as well. The review of the National Drug Master Plan as it was, we responded to the 3 international conventions as well as UNGAS, and we took a big lead from what has been said already in terms of what came out from UNGAS 2016, and particularly how it relates to our situation here in South Africa and how that can be imported into the needs of our community, which is very, very different to some of the other countries. And we need to be very, very sure that we are addressing the needs of our people, because that is who we are here to look after. Again, who are we responsible to? We are responsible to our community. We are responsible to the people in our country as well. So as such, we needed to identify those specific needs and set out the roles and the responsibilities for each of the departments that we are working with, and to guide them in terms of what our policies are and how we see that they should be working with us. In order to do that, we've always recognized that they have their own mandates, but that what we are trying to do is to guide them in such a way that we can collaborate with each other and work closely, and at the same time then have a meaningful and a policy that works for all of us. We summarized the national policies, defined the priorities, and also then apportion the responsibilities to each of the different people. The starting point was to have a task team, which was made up of representatives from both the Central Drug Authority, as well as looking at outside agencies to assist. And the first one that we turned to, obviously, was the UNODC for technical assistance. We also looked at the UNGAS and their recommendations, which then guided us in terms of the way forward as well. We try to do as best as possible a situational analysis of what and how big the problem is, how many people are we talking about, how big is the problem. We ourselves don't have any stats, because we don't have the ability to conduct any research, because we ourselves don't have a budget. And these are the problems that we have. So we have to draw from all the information that is available to us from other departments, other agencies, and use that as our guiding principle. How do we determine how well we are doing? Well, if we don't know where we're starting from, how can we ever measure how the input is going to be? So clearly what we're understanding from this is that we have identified the fact that we need to be totally independent with our own budget, and in that case to be able to do the necessary research as well. We've had consultation, as mentioned before, for the first time with the people using, the people injecting drugs, because if we are going to formulate a policy for them, we need to hear from them as well. And in the development of this new National Drug Master Plan, it's the first time that we've had an opportunity to sit around a table 3 days, 4 days, irrespective, but we heard it from them themselves. What is it that they expect from us? What is it that we can do for them? What is it that they would like us to do for them? And that has given us a very good insight as well. We also looked at, thank you, we also looked at the DPME evaluation which was done, which analyzed the past master plan and gave us direction on and certain recommendations on how to improve as well. Identifying the key experts in the field of substance abuse, also to assist us in formulating the policy, and defining the format of the new National Drug Master Plan, where we are looking at more of a bottom-up approach, rather than what has been used before as a top-down approach. We need to also recognize that we are formulating a policy that needs to be worked at grassroots level, and we need to deal with those policies in such a way that they can understand it. So it has to be written differently to the way it is written at the moment. It needs to be less academic and more practical for the people who are going to be the implementers, and they need to be capacitated as well. So we've consulted with the provinces, and particularly in the provinces with the NGOs and the local drug action committees in the facility in order to facilitate their needs as well. Consulted with the Deputy Minister, because as I said, that is who we are at the end of the day responsible to, and we have to align with the thinking within that department as well. And then compiling a draft of inclusive recommendations based on the recommendations that were given to us on the review done by the DPME. That brings us now to the point where we are busy with a draft plan, which will be sent back to the provinces, and we will get further input from them as well, based on which we will then be in a position to be advising Parliament and having consultation with them, coming back to finalize the draft, and then giving a complete cabinet memo for approval by Parliament. We looked at the three-dimensional approach, where we spoke about the host and the stakeholders that we're having to deal with. We also used, as I said, the PESTEL, which I will explain in a minute, and then looking at the integrated interventions that we are using. So The hosts and the stakeholders that we were speaking to were the target populations as identified in the existing Drug Master Plan 2013 to 2017. We also had representatives from the different departments that we consulted as well, and we held a meeting with all of the different legal departments within, all the legal beagles rather, within the different departments to see how we can align all of their acts in order to be able to accommodate what we need for our implementation of policy as well. The needs presently contained in the National Drug Master Plan outcome are continually being reviewed, and I see I only have 5 minutes left now, so I'll continue this evening when everybody's gone. The integrated approach that we are using is still the demand, the supply, and the harm reduction. The PESTEL is a predicted outcome asking people to give us an indication of, from a political point of view, from an economics point of view, from a social environment, technological environment, and the environment that they're working in, and the legal, how they would see this impacting on the way going forward. So the integrated and balanced approach using the field of substance abuse is generally accepted that no single approach works, such as criminalizing or decriminalizing substance abuse, that would solve the problem for us. Instead, we need a balanced approach that uses the integrated combination, and as I said, working with the simple philosophy of the 3 pillars being demand reduction, supply reduction, and harm reduction. Included in the harm reduction, though, is where the emphasis has been placed is in terms of a private and public health model to include all of the needs that we've spoken about as well. So the review of the South African situation was done where we looked at the documents and more specifically the objectives of the analysis to identify the areas of vulnerability, outline the nature and the extent of substance abuse, and to conclude with an outline of the service delivery and research. We identified the need for a nationally acceptable database, which we don't have, and that's what I spoke about earlier, where we need to have something that we can use as a reference, and information to assist in continuously adapting the strategy, because what we are determined is that this will be a living document and will have to be reviewed on a continuous basis in order to keep ahead of the changing environment that we're finding ourselves in, particularly at the moment. The PESTEL refers to, as I said, those 6 elements, the political, economic, social. They are described as statements of facts as to how the people that we are interviewing and answering the questionnaires for us see and predict the changes that are going to be taking place in the future and how we can align ourselves in order to be able to deal with those particular developments. So the Drug Master Plan as it stands at the moment in its draft form has 6 chapters. And I'll explain each of the different chapters to you briefly so that you have an understanding of what we are addressing within those chapters. The first one being the key factors influencing the choice of strategy meant that we needed to look at the various factors around substance abuse that have been in place for donkey's years, as long as we can know that it has been around for. And the key factors recognizing addiction as a disease rather than just a social problem, which is a major mindset and a paradigm shift that we need to get our own department, being the Department of Social Development, to accept that this is not just a social development problem, this is a problem that encompasses a lot more than just them. And that they need to accept that there is the need for a move towards the health model as well. The realization that the total elimination of drug abuse is not possible, and it is reaffirmed by UNGA's vision rather to achieve a society free of drug abuse rather than a drug-free society. And at the same time, the acceptance of the need for research and data collection, which I've already alluded to. Based on that, we have the 4 pillars that we are working also, which comes from UNGA's. The prevention of drug abuse, the treatment of drug abusers, their rehabilitation and reintegration back into society, and that continuum of care, that continuum of treatment. The control over accessibility and supply reduction related matters, such as, for example, crime, money laundering, people trafficking, and the other judicial interventions that are necessary as well. Chapter 2 then talks about substance abuse.
We say that there's 1 minute. But because we don't have a 7 o'clock appointment tonight, I want you to be able to complete this because it's important for us.
Thank you.
In a relaxed way. And I would make sure, people, that we are out here before 7 o'clock. I promise you.
I promise you too. So, Chapter 2 then speaks, as I said, about the status of substance use in the country as it is at the moment. And it describes the analysis available information using the data that is available to us going back from 1990 right up until the present time that we're in at the moment. And the need for an integrated strategy looking at the social, the judicial health, and all other relevant stakeholders. I must just also mention at this point that we have engaged with the Justice Department, we have engaged with the MPA, we have engaged with all of the legal people in order to align their thinking in terms of what we are seeing and recognizing as being the need for moving towards the decriminalization in answer to your next question. So we are certainly aware of the fact that there needs to be a change, but it's very, very difficult to tell a policeman what to do. He has got his mandate. He has got to tick the tick boxes as well. And it's very, very difficult to get them to understand. We have already had 3 or 4 meetings with them, and we are beginning to see that there is now progress in understanding that there is a need for them to change the direction that they are moving in as well. So looking at Chapter 2, we've spoken about the host, we've spoken about the agent, we've spoken about the environment, and we have now included in that the 4th element, which is that public health model that we need to endorse as well in terms of the treatment that is necessary to be able to deal with that problem. It provides the availability of data in terms of the general level of substance use, the patterns, the access and the demands that are made, the socio-demographics of the people that we're having to deal with, and to understand that perfectly, because it's very, very different going from one area to another, going from one region to another. Substance use by persons in conflict with the law, and the link between users and their environment, the socio-economic deprivation that needs to be dealt with as well in order to be able to give a solution to the problem, the age of substance use, the polysubstance use, the levels of use, the primary substances of abuse, and all of these various other factors that influence the use of drugs that need to be dealt with going forward, which have never been dealt with in the past. We have never looked at the environment. We have never dealt with the environment. We have never addressed that, and we need to make sure that government starts doing something in order to be able to address the problem from that perspective. Chapter 4 then talks about the PESTEL and the selection of the National Drug Master Plan strategy based on the assumptions, but those are informed assumptions by people who are working in the field and understand it clearly. So the chapter describes those aspects as discussed in the previous chapters and includes a 3-dimensional analysis using the PESTEL as being one of the guiding principles as well. It also identifies then the strategy that we are using in formulating the policy going forward. It provides the factors that reduce use and dependency, such as stability, creating opportunities for people, the appropriate medication in order to make treatment available, particularly talking about OST and medically assisted treatment, the supportive relationships that we need to create in terms of how do people be reintegrated back into society, which hasn't changed, but needs to change in order for these people to be able to be reintegrated, and how are we going to be working with them? The appropriate rehabilitation services that are necessary, and also at the same time, as part of our obligation, to ensure that the rehabilitation programs that are being implemented at treatment centers are appropriate for the people that they are treating as well. The psychological relocation, and we use the PESTEL analysis in order to be able to give us the predictions that are necessary for a 5-year period as well. The strategic application of the key solutions are linked to the plan of action for their implementation. And the solutions incorporated through the application of a rationale of theory of change, which is something, again, that we need to apply our minds to. We cannot carry on doing what we are doing at the moment because we are not impacting and we are not making an impact. So we needed to have a theory of change in terms of our thinking as well. And the DPMA assisted us in dealing with that. It describes the outcomes, the outputs, and the objectives that we are looking to achieve. Chapter 6 then is, for me, I think, one of the most important areas where we are going to be involving ourselves as a central drug authority going forward, and that is the monitoring and evaluation and the reporting. We are not implementers as the Central Drug Authority. We are there to guide, we are there to give policy, we are there to give direction. And what we need to do is we need to then monitor those people who are responsible, whether it be at the provincial level, whether it be at a local level, or whatever level, departmental level. We need to then monitor and ensure that they are doing what has been prescribed for them in the National Drug Master Plan. So this chapter describes the process of monitoring and evaluation, and that is something that we are hoping will be applied more specifically by the new Central Drug Authority when it is appointed as well. The monitoring is an ongoing tracking of the progress against the plans and initiating the corrective action that needs to be taking place, and that's why I said it remains a living document where we will have to change based on the evidence that we are seeing as we monitor and as we go forward. The evaluation, on the other hand, is a systematic collection of objective analysis and evidence to access issues such as relevance, performance, and the value of money, impact, and sustainability. And we've certainly seen how the issue around whether we are wasting money by criminalizing and whether it couldn't be better used by decriminalizing, those are the type of issues that we're looking at. Coming back then just to the structure that we have at the moment so that you understand where the CDA fits in, we sit directly, as it shows over there, under the Minister, but that we take our inputs from the people that we are working with in the field, being the public in the first instance, and that's another person that we are responsible to, is the public, ensuring that we're giving them what they require and what they need. We also take input from the different departments in terms of what they are capable of doing, and that then gives us an opportunity to then escalate it down to the provinces in order for them to do the necessary work for us as the implementers as well. The departments each have to have their own drug master plans for their departments, and all of that then filters back to the municipalities or the local drug action committees, an area that we need to address. And let me just say that this is what is prescribed at the present moment within the Act that we are working with. We recognize that the Act has got lots of flaws, and the Act as it is at the moment is now also being reviewed in order to address the problems that we've identified, particularly at the local drug action level and the municipality level. They then give us the input from the NGOs. So this gives us a complete oversight from the grassroots level right up, and we are working with it from that perspective. Looking then at where we are in terms of the planning of the National Drug Master Plan and the processes that we're talking about, we have finalized the workshops that we've had with the people who are using and people who are injecting. We have met, as I said, with the magistrates, the MPA, the Department of Justice. We've had many workshops with them already, and that is an ongoing process where we are still trying to come to some consensus about how best they can align themselves in terms of what we recognize as being essential in order to deal with this decriminalization issue that we're having to face and that we want to impact on as well. The draft National Drug Master Plan consultative workshops are taking place. We are going to each of the provinces in order to take inputs from them, from the NGOs, and that means, in other words, from the grassroots level as well. That then gives us an opportunity to then work with the national government departments as well in order to get their inputs and to give them direction in terms of what we would like them to be able to do to support, to collaborate, and to bring us back onto the same page. Those consultations then are taken to the clusters, and we are working with the different clusters in order to make sure that it is acceptable by the different clusters as well. Thereafter, it will be taken as a cabinet memo for final approval by government. And that is the process that we are following. As I said, we are only at the very first stage. We are busy with draft 0, and there's plenty of opportunity for inputs from everybody, and we would welcome that as well. Thank you very much.